شباب المرحلة الأولى، السلام عليكم ورحمة الله وبركاته. اليوم محاضرتنا عن الاناتومي of the leg, that is the fascial compartments of the leg. At first, the leg is that segment of the lower limb that extends in between the knee joint and the ankle joint. Skeleton of the leg consists from the tibia bone medially and the fibula laterally. What are the cutaneous nerves that supply the skin of the leg? First, the lateral sural cutaneous nerve, supplying the upper part of the anterolateral surface of the leg. Next, we have another nerve that is called superficial peroneal nerve, which is a branch from the common peroneal nerve that's supplying the lower lateral part of the leg. Another nerve, which is the saphenous nerve, which is a branch from the femoral nerve, supplying the anteromedial surface of the leg. The posterior surface of the leg is supplied by, in its upper part, by the posterior cutaneous nerve of the thigh, supplying the posterior aspect of the upper part of the leg. The lateral cutaneous nerve of the calf, supplying the posterolateral upper part of the posterolateral surface of the leg. And the sural nerve, which is a branch from the tibial nerve, supplying the posterior aspect of the leg. Next, if we remove the skin and superficial fascia, we will find the deep fascia. The deep fascia, this is a continuous above with that of the fascia lata of the thigh. The deep fascia of the leg surround the leg as a whole, and it is attached, have certain attachment to the bones. With the deep fascia, with the presence of the interosseous membrane, this is the interosseous membrane that connects the interosseous borders of the tibia and fibula, will form compartments. This is the tibia and fibula, and they are connected by the interosseous membrane. This is the deep fascia sending septa. This is the anterior and posterior septa will divide the leg into compartments. These compartments, we have the anterior compartment, the lateral compartment, and the posterior compartment, divided by a transverse septum into a posterior compartment with deep part, posterior compartment, superficial parts, by the presence of deep fascia septa. Each compartment having its own muscle, its own blood vessels and nerve, and also each compartment having its different function. What we call the reticula? Reticula معناها in Arabic معناها القيد. Reticula is an extension or thickening of deep fascia. Thickening of deep fascia that hold the tendons in position. Here we have the superior extensor retinaculum extending in between the distal end of the tibia and fibula, and we have the inferior extensor retinaculum, which is a Y-shaped thickening of deep fascia holding the extensor tendon in position. We have a flexor tendon medially, and we have the superior peroneal and inferior peroneal retinaculum on the lateral aspect of the ankle region. Here we can see laterally the peroneal retinaculum, superior peroneal retinaculum extending from the lateral malleolus to the lateral surface of the calcaneum, and we have the inferior peroneal retinaculum extending on the lateral aspect of the calcaneum holding the tendons of peroneal muscle in position. On medial aspect of the ankle, we have the flexor retinaculum, which is also a thickening of the fascia extending in between the medial malleolus and the medial surface of the calcaneum, holding the tendon of the posterior aspect or the posterior compartment of the leg in position with the tibial nerve and tibial artery. What is the content of the first compartment, which is the anterior compartment? Muscle, we have the tibialis anterior, extensor digitorum longus, peroneus tertius, extensor hallucis longus. What is the blood supply to this compartment? Is it through anterior tibial artery. What is the nerve supply? Is it through deep peroneal nerve. What are the muscle of the anterior compartment? Here in this picture we can see the tibialis anterior muscle, that is related to the tibia, we call it tibialis anterior. Extensor digitorium longus, because this muscle will pass to the digits and it is extensor, which we call it extensor digitorium longus. We have another muscle that is called extensor hallucis longus that is related to the big toe. Here this extensor muscle passing under the extensor retinacula, and we can see that the first muscle from medial to lateral is the tibialis anterior. Next we have the extensor hallucis longus. Next we have the extensor digitorium, and as a part of the extensor digitorium is the Peroneus tertius. Peroneus tertius, this is a small muscle that extends to the base of the fifth metatarsal bone. All these muscles pass under the extensor retinaculum, superior and inferior extensor retinaculum. What is the artery of the anterior compartment? Is the anterior tibial artery. Anterior tibial artery, this is a branch from the popliteal artery. Anterior tibial artery originates from the popliteal artery at the lower border of this muscle, which is the popliteus muscle. It passes forward through an opening in the interosseous membrane to pass to the anterior compartment. Here, it will pass in the anterior compartment. At first, in the upper part of its course, it runs deep. هيكون course مالته deep to the muscle. Lower down, it becomes superficial. Here, it becomes superficial in between the tendons in the ankle region. Here, the artery will pass in front of the interosseous membrane, accompanied with the deep peroneal nerve. As it reaches the region of the ankle, here anteriorly, as it passes in front of the ankle joint, it will become what we call the dorsalis pedis artery. Dorsalis pedis artery. Here, the dorsalis pedis artery is related medially. It have the extensor hallucis longus medial to it, and laterally is the deep peroneal nerve and the extensor digitorium longus muscle laterally. What is the nerve supply of the anterior compartment? Is through the deep peroneal nerve. Deep peroneal nerve is a branch from the common peroneal nerve that pass near the neck of the fibula. The deep peroneal nerve, here we can see this is the deep peroneal nerve, descend deep to the extensor digitorium longus. This muscle, extensor digitorium longus, to give muscular branches, definitely to give muscular branches to the anterior compartment and muscular branches to the tibialis anterior, to the extensor digitorium longus, peroneus tertius, and extensor hallucis longus, and give an articular branch to the ankle joint. The lateral compartment that is related to the fibula here, it is surrounded by the anterior and posterior fascial septa. The muscle here, we have two muscles. We have the Peroneus longus and the Brevis. Blood supply is through peroneal artery, and the nerve supply is through superficial peroneal nerve. These are the muscle. Another name is the Fibularis longus and Fibularis brevis, or Peroneus longus and Peroneus longus and Peroneus brevis. And we can see how they are passing behind the lateral malleolus under the cover of the, or it is held by the peroneal retinaculum, superior and inferior peroneal retinacula. Here we have laterally, this is the Peroneus longus, and behind we have, or below we have Peroneus brevis. They acquire a synovial sheath and they pass under the superior peroneal retinaculum. Then under the cover of the inferior peroneal retinaculum, at first they have a common synovial sheath, then each one having its own synovial sheath. The Peroneus brevis will pass to the base of the fifth metatarsal bone, while the Peroneus longus will pass deep to the cuboid bone to be inserted to the bone on the bone of the foot. These are the tendons of the Peroneus longus in the blue and the Peroneus brevis in yellow color as they are passing to their insertion. Another picture. Here we can see how the superior peroneal retinaculum and inferior peroneal retinaculum holding the tendons of peroneal muscle, holding them in position. These tendons will keep these tendons will keep the lateral longitudinal arch of the foot. يعني راح تحافظ لي على تقوس القدم من الجهة البعيدة. كذلك تحافظ لي على تقوس القدم اللي هو نسميه transverse arch. We have a medial arch, medial longitudinal arch, lateral longitudinal arch, and we have a transverse arch. يعني تقوس القدم أن يكون من تقوس من الجهة القريبة، تقوس من الجهة البعيدة، وتقوس من الوسط أو بشكل مستعرض. اللي يحافظ لي على التقوس من الجهة البعيدة هو التندن of Peroneus longus، وكذلك يحافظ لي على الترانسفيرس arch هو التندن of this muscle. Blood supply to the lateral compartments is through peroneal or fibular artery. This is a branch from the posterior tibial artery. It passes down posterior to the fibula, and it passes either through the flexor longus, either through this muscle or behind this muscle, and give branches to supply the lateral compartment of the leg. It will give muscular branches to supply the muscle and give a nutrient artery to the fibula, give an anastomotic branch around the ankle joint here. What is the nerve supply to the lateral compartment is through the superficial peroneal nerve. Here we can see that the common peroneal nerve against the neck of the fibula in the substance of Peroneus longus, it will divide into the deep peroneal nerve to the anterior compartment and the superficial peroneal nerve to the lateral compartment here. This is the superficial peroneal nerve, descend between the Peroneus longus and Peroneus brevis, in between the two muscles. It will give muscular branches definitely to the Peroneus longus and the brevis. And in the lower part it will become cutaneous. In the lower part it will become cutaneous branch. Cutaneous branches are medial and lateral branches. يعني شوف هاي cutaneous branches, it will supply the dorsum of the foot, except the area or the region in between the first and second digits that's supplied by the deep peroneal nerve. Posterior compartment of the leg, as we said before, can be divided into a deep compartment and a superficial compartment by the transverse septum. Here we have, this is the interosseous membrane, tibia, fibula, interosseous membrane, and this is the transverse septum dividing the posterior compartment into deep one and a superficial one. The first, from the skin, what are the nerve supply of the skin? The sural nerve here, the sural nerve, which is a branch from the tibial nerve, will supply the back of the leg, and it is have a lateral communicating branch from the common peroneal nerve. It is accompanied with the small saphenous vein. This is the small saphenous vein that begin from the lateral side of the dorsal arch of the foot, ascend with the sural nerve behind the lateral malleolus on the lateral side of the calcaneal tendon or Achilles tendon, and this vein will ascend up until it reaches in between the two heads of gastrocnemius to drain into the popliteal vein. As we said, small saphenous vein is accompanied with the sural nerve. Here the small saphenous vein accompanied with the sural nerve. The sural nerve will accompany the small saphenous vein, and as we said, they pass behind the lateral malleolus. Sural nerve, here the area in the red color, supply the area in the red color, that's we can see usually joined by the sural communicating branch of the common peroneal nerve. اللي هو هذا. Supply the skin of the calf and the back of the leg. Supply the skin along the lateral border of the foot and the lateral side of the little toe. What are the content of the posterior compartment of the leg? We have a superficial group of muscle here, gastrocnemius, soleus, and plantaris. The deep group deep groove, we have the popliteus, flexor digitorium longus, flexor hallucis longus, and tibialis posterior. Blood supply is through posterior tibial artery, and the nerve supply is the tibial nerve. Here we can see the superficial group of muscle. أول عضلة قاعد نشوفها هنا هي هاي gastrocnemius that have two head, the medial and lateral head. The head of the gastrocnemius, we have a medial and lateral head. Next, if we remove gastrocnemius, we will find the plantaris. This is thin and long muscle, plantaris. And next we have the soleus. These three muscles will have a common tendon of insertion that is called calcaneal tendon or Achilles tendon. Calcaneal tendon or Achilles tendon that is regarded as the thickest tendon in the body. It will be inserted or attached to the calcaneum. Calcaneal tendon. These are the muscles. The deep groove, we have the popliteus muscle here. This is triangular in shape. Next, we have the tibialis posterior, flexor hallucis longus, and flexor digitorium longus. Here we have these tendon of the muscle that pass to be inserted to the sole of the foot. شوف هنا عندنا هذه هي flexor hallucis longus that pass to the big toe, to the distal phalanx of the big toe. These are the tendon of flexor digitorium longus that pass to the lateral forefinger distal phalanx on the tendon of tibialis posterior. On the medial aspect of the ankle, we have the flexor retinaculum. As we said previously, this is a thickening of the fascia extending between the medial malleolus and the medial surface of the calcaneum. It will hold this tendon of the back of the leg or posterior compartment of the leg in position, with the posterior tibial artery and the tibial nerve passing behind them, behind the medial malleolus. So this retinaculum will hold this tendon to the back of the medial malleolus. Arrangement of this tendon قاعد نشوف انه tibialis and tibialis posterior. Then we have the tendon of flexor digitorium longus. Then with the flexor hallucis longus. Flexor hallucis longus. What is the blood supply to this compartment is through posterior tibial artery. Posterior tibial artery, it is a branch of the popliteal artery. It begins at the lower border of the popliteus muscle. Passes downward deep to the gastrocnemius muscle and soleus. It lies on the posterior surface of the tibialis posterior muscle. What are the branches of the posterior tibial artery? First is the peroneal artery. This artery arises from the beginning of the posterior tibial artery, and it will supply the lateral compartment of the leg, and it will send muscular branches and a nutrient artery to the fibula. This is the posterior tibial artery. Next, we have muscular branches of posterior tibial artery supplying the muscle of the superficial and deep groove, a nutrient artery to the tibia. We have anastomotic branches around the ankle joint, and we have lastly this posterior tibial artery as it passes behind the flexor retinaculum. It will, in the sole of the foot, it will divide into medial and lateral plantar arteries. And these are the two terminal branches of the posterior tibial artery. Here we can see that the posterior tibial artery passing under the flexor retinaculum, and here it is situated in between the tendon of flexor digitorium longus and the flexor hallucis longus, and we can feel the pulse of this artery in between the tip of the medial malleolus and the tip of the calcaneum bone. Here we can see here another figure showing how the structure passing under the flexor retinaculum and the posterior tibial artery passing under the flexor retinaculum in between, surrounded or related to the tendon of flexor digitorum longus and the tendon of flexor hallucis longus muscle. with the tibial nerve. طبعا هنا راح يكون ال artery is medial to the tibial nerve. As it passes below the retinaculum, it will be divided into the medial two terminal branches, medial plantar artery and the lateral plantar artery. The last part of our lecture is about the tibial nerve. As we know from the previous lectures that the sciatic nerve at the lower 1/3 of the thigh in the popliteal fossa, it will divide into a medial larger branch called tibial nerve and a lateral smaller branch called common peroneal. Here we are concerned with the tibial nerve. The tibial nerve, it is the larger medial terminal branch of the sciatic nerve that pass in the popliteal fossa. This tibial nerve will pass through the popliteal fossa and it will disappear at the lower border of the popliteus muscle. It will disappear behind gastrocnemius and soleus. And it become posterior to the muscle here tibialis posterior. It is accompanied with the posterior tibial artery. Then in the region of the ankle on the medial aspect, the tibial nerve accompanied with the posterior tibial artery. Both of them, they are situated in between the tendon of flexor digitorum longus and tendon of flexor hallucis longus. It will pass deep to the flexor retinaculum and it will divide in the foot. It will divide into the medial and lateral plantar nerves. These are the two terminal branches of the tibial nerve in the foot. Here we can see the deep dissection to the sole of the foot, how the tibial nerve is divided into a medial plantar nerve and a lateral plantar nerve. Medial plantar nerve and a lateral plantar nerve. Another nerve is the called branch of the tibial nerve is called the medial calcaneal branch. Medial calcaneal branch supplying an area on the medial aspect of the heel, on the medial aspect of the heel of the foot. Thank you.